Dr. Ken Landau. Thanks for watching. Let's talk about Vraylar. Vraylar, or cariprazine, is a drug that's in the antipsychotic family, the atypical antipsychotic family, if you will. It was approved in 2015 for treatment of acute attacks of schizophrenia or for the acute attacks of mania associated with bipolar disorder. And then in 2017, it was authorized for sale as a maintenance therapy for people with schizophrenia, although it was turned down specifically as a treatment for the negative symptoms of schizophrenia, and I'll tell you what that is in a moment. This drug is the third drug in the family of the dopamine partial receptor agonists, or antipsychotics. It goes along with Abilify and Rexulti. Now, these drugs are being studied for a number of medical disorders. They're being studied for treatment of depression or anxiety or insomnia. And it's estimated that somewhere in the latter part of 2018, the company behind Vraylar is going to ask the FDA to authorize it for treatment of the depressive portion of bipolar disease. Now, schizophrenia itself, serious implications for the patient, leads to a lot of personal distress. We can divide the symptoms into positive symptoms, negative symptoms, and generalized symptoms. So the positive symptoms of schizophrenia are delusions and hallucinations and excitement and grandiosity and suspiciousness and persecution and hostility. There are thought disorders and movement disorders and conceptual disorganization. And then we have the negative symptoms, the blunted affect, the apathy, the poor rapport, the emotional or social withdrawal. We have a lack of spontaneity, a lack of motivation, a lack of will, lack of drive. We have stereotype thinking. And then we have the general symptoms associated with schizophrenia. Poor attention, poor impulse control, guilt feelings, depression, difficulty with executive function. You can't plan ahead, can't focus, poor working memory. So we can rate that all on the PANSS scale. And that can give us an idea how bad the schizophrenia is, and then how much improvement we get with our therapy. So on this scale, you're mildly ill at a scale or score of 60, moderately ill 75, markedly ill 100, severely ill 120. Now, to show significant clinical improvement, you need a minimal 20 to 30% improvement. So let's see how well the drug does. Well, when a person is given Vraylar, day 1, they take 1.5 milligrams. Day 2, 3 milligrams. And then over time, it can slowly be increased up to 6 milligrams. It can be taken with or without food. The FDA approval was on the basis of several studies. It was studied against a placebo, of course, but then it was also studied against Risperdal and Abilify, also atypical antipsychotics, looking at people who were just south of severely ill, so they were almost at the junction of moderately ill to severely ill. Vraylar caused about a 20% improvement in the symptoms, so that's good. Placebo caused about a 10 to a 15% improvement in the symptoms. That's close. Risperdal caused a 27% improvement. That was even better. And Abilify caused, again, about a 20% improvement, which is the same as with Vraylar. And as a matter of fact, when it was studied a little more carefully, it seems that Risperdal might be associated with more improvement on the scale, both in terms of the positive symptoms and the negative symptoms. And the number of people who responded, the percent of the people who responded, well, it was only about 30% of the people who responded when they were given the Vraylar against 20% with the placebo. And when we look at the likelihood of relapse, Yes, it was a little bit better with the Vraylar than it was with the placebo, but it wasn't a cure of the disease. And as a matter of fact, if we look at overall the other trials that were done, it seems that the degree of improvement with Abilify was more than it was with Vraylar, and Vraylar and Rexulti were about the same. So let's switch over to bipolar disorder. Bipolar disorder affects 3.5 to 4 million people here in the country. Bipolar, two poles, one mania, the other depression. Mania, you're overexcited, racing thoughts, difficulty with sleep, extreme irritability, and the depression part, of course, the sadness, the feeling blue, the hopelessness. So the question is, does Vraylar significantly improve people who have the manic stage of bipolar disorder? And again, we have a rating score. It happens to be the Young Mania rating scale in this condition. And when we look at the patients, who again begin at the dose of 1.5 milligrams, and then we increase it to 3 milligrams on day number 2, and then can be increased after that, well, Vraylar is a little bit better than placebo, but not a whole lot better. And as a matter of fact, when we compare in bipolar mania, if we look at Abilify, Abilify seems to work as well. And as a matter of fact, while we're talking about other therapies, one of the standard therapies for mania is lithium. Lithium is just an element on the periodic table like calcium or like sodium. Now, the World Health Organization says that bipolar disorder is the 6th most common cause of disability in the entire world, and it has a low remission rate, and long-term therapy is necessary. So does lithium work? Yeah, it sure does. Does it have side effects? Sure. All drugs have side effects. So it can cause nausea, vomiting, diarrhea, abdominal discomfort, fine motor, tremor. It can cause thirst, polyuria, cause some drowsiness, clouded thinking. If you take a high dose, it can affect the kidneys, can affect the thyroid, but most people can be quite adequately treated with a moderate to a low dose. And as a matter of fact, just in February of 2018, from Sweden at the famous Karolinska Institute, and published in the JAMA Psychiatry, Journal of the American Medical Association Psychiatry, looking at 18,000 people, it seemed that of all of the therapies, when looking at specifically re-hospitalization, it seemed like lithium was the best of the bunch. Well, on Vraylar, where were the studies carried out? In large measure, they were carried out in Hungary and in Romania and in Russia and in the Ukraine and in India. They were funded by the drug company, and often at least one of the authors worked for the drug company. Now, this is just a standard atypical antipsychotic. All of the antipsychotics work on the dopamine 2 receptor. There's another dopamine receptor, dopamine 3 receptor. The atypical antipsychotics work on that. Additionally, this drug works on the serotonin receptor. Now, it has a very long half-life, which can be good and can be bad. So if you forget to take a pill, that's not such a big deal because it's got a really long half-life. But unfortunately, by really long, I mean if you stop the drug after a while that you've been taking it, a month later you have significant amounts of some of the metabolites still in the body, and they're even measurable at 2 months. This drug is not for women who become pregnant. If you take it during your 3rd trimester, it's going to cause significant problems in a lot of the babies, some needing long-term hospitalization. Lactation, it hasn't been studied. Geriatric population, most of the studies are just up to age 65. We do know that if you have liver or kidney disease, this is one of those risky drugs to take. And certainly if you're elderly and if you have dementia-related psychosis, symptoms like with schizophrenia, this drug seems to double the death rate. Deaths from heart failure and sudden cardiac death, and from pneumonia. There are some warnings and precautions about this drug. So it can cause the neuroleptic malignant syndrome, where the body temperature goes sky high, the muscles become rigid, person becomes delirious, has autonomic instability with the blood pressure up and down and the heart rate. The muscles can break down. Some of the protein in the muscle, the myoglobin, gets into the bloodstream. It can block the kidneys and lead to kidney failure. It can also be associated with stroke and transient ischemic attacks, mini strokes in the elderly. It can cause a movement disorder known as tardive dyskinesia, especially in older women, especially in people who've been taking the drug for a long time, but it could occur with a low dose and with even short-term therapy. It can cause significant damage to the white blood cells. It allows you to have an increased incidence of infection. Sometimes it stops the white blood cells from being made, can cause an agranulocytosis. If you happen to be susceptible to seizures, can worsen the problem, and can cause metabolic changes that can increase your body weight and increase the incidence of diabetes and increase your cholesterol. And it can lead to what's known as orthostatic hypotension. You stand up, your blood pressure falls down, and then you fall down too, especially if you're a vulnerable individual, an elderly person, thin, dehydrated, have a history of heart disease or cerebrovascular disease. And it can cause significant cognitive and motor impairment. So if you're driving a car, that might be risky, or certainly operating heavy equipment. You have impaired judgment or thinking or motor skills with this drug. And it can lead to impairment of function. It can lead to something known as extrapyramidal symptoms. Extrapyramidal symptoms, up to 30% of the people with spasms and tremors and motor restlessness and rigidity, sort of like a Parkinson's disease condition. And that's relatively common, and it can cause restlessness and vomiting and sleepiness, cause a temperature dysregulation of the body, where if you exercise or you're exposed to extreme heat or you're dehydrated, your blood temperature, your body temperature can go way up, and it can lead to dystonia, prolonged abnormal contraction of muscles, spasm of your neck muscle. It can lead to tightness in your throat, difficulty swallowing or breathing, protrusion of your tongue. And in animals, in dogs, it can cause cataracts. And in rats and mice, it can cause a deposition of what's known as phospholipids inside the lungs. And that's with or without inflammation. And also the same kind of deposition in the adrenal cortex. And by a year after you start therapy, about half of the people have stopped. A considerable number stop because the drug causes a problem with insomnia or weight gain. And the drug can interfere with the metabolism of other drugs, or other drugs can interfere with the metabolism of this drug. So you have to be very careful what kind of drug you're taking, because it might increase the concentration of the Vraylar, or it might decrease the concentration of Vraylar. And remember, after you discontinue the drug, there's going to be some in your system for as long as several months. Well, the antipsychotics, we divide them into the first generation and the second generation. First generation discovered a long time ago, second generation more recently. The typical and atypical drugs. The typical drugs work just on the dopamine 2 receptor, the atypical drugs on the dopamine 2, dopamine 3 receptor, and some other areas of the central nervous system, so that hopefully they cause a smaller number of side effects. Less spasm, less stiffness, fewer of those extrapyramidal symptoms. The drugs first came to the market in the mid-1900s. That was the typical family. The atypical family, with Risperdal, 1990, had fewer side effects, less anticholinergic side effects, less dry mouth, less blurred vision, less problem with confusion in elderly individuals. Series of those drugs available now. Most of the drugs work on this D3 receptor. Many of the drugs work on the D3 receptor. Has a more favorable side effect profile compared to the older, more typical drugs. But the question really is, do we need more drugs in this family? It's kind of overcrowded. There's no special benefit of Vraylar. It doesn't seem to be more effective or more tolerable. It doesn't seem to have a favorable metabolic profile compared to the other drugs. The only benefit, or one of the benefits, is if you forget a dose, it's so long-lasting it'll still be there. But the real issue is, since it's basically working in the same family, or works as does Abilify or Rexulti, is there any special benefit for this drug? And the answer is, I'm not sure there is. The drug was developed not by Allergan, who's charging an awful lot of money for it, but it was originally developed by Gideon Richter Pharmaceuticals out of Bucharest, Hungary, Budapest, Hungary. And originally, it was found as a contaminant in something else that they were manufacturing. And then they isolated it, purified it, and they found it seemed to work even better than the compound that they're working on for psychosis. It's sold in America and in Canada as Vraylar by the Allergan Pharmaceutical Corporation. There's a company called Recordati that's out of Milan, Italy, that sells it in Western Europe and Algeria and Tunisia and Turkey. The question is, how much does it cost? And the answer is an awful lot. If you want to pay cash for it, it's about $45 to $50 a day. A day! That's an awful lot of money. If you have a coupon, it could be $30 a day. If you take lithium, let's say for the Mania, well, you can get that for anywhere between $4 and $20 a month. If you get the Rexulti, because the Rexulti was only approved in 2015 for the schizophrenia, well, that's going to be expensive. That's about $1,000. You could buy the Abilify. That's $1,000, but the generic form is less than $60 a month. And if you got the Risperdal, well, you could buy that one for about $300 a month with the coupon, the brand name. But if you wanted the generic, you could get that for as little as $10 to $20 a month. So here with the Vraylar, we have a very expensive pill. For schizophrenia, it seems to work about as well as a $10 a month pill, but with Vraylar, it's $45 a day. For mania associated with bipolar disorder, again, $45 a day versus less than $10 or $20 a month. Unfortunately, the drugs are being handed out like candy in medicine right now. Lots of people, lots of kids, lots of adults taking these drugs for a variety of disorders. But these drugs carry a significant number of side effects. I think what we need to do is we need to be a little more cautious about the way some of these drugs are being prescribed and consider some alternatives. Anyway, that's my thought. Thanks for watching. I'm Dr. Ken Landau.